Hello, everybody. I'm getting this open again for today. The topic today is the National Day, the International Day against Homophobia, Transphobia, and Biphobia. That's the topic for today, y'all. So it's gonna be good, interesting. So I'm just waiting for my. What's up, everybody? I'm just waiting for my colleague to come in, and I will get started. Oh, the comment did not pin appropriately. Let me redo it. Um, Let me redo my pin because it didn't post that. Whitman-Walker Held. Again. 403. HOV. Okay. Accept. Hello. I don't know. Walker Held is open again. So, 1 second, y'all. I'm coming. STI testing. Appointment only. Please call 2717 to make an appointment. Post. Okay. All right, we're good. Let's get started. Little thing is acting up. Okay. So during the past few months, Whitman-Walker Community Health Department has expanded its outreach efforts and social media platforms. We cover various topics about HIV/STI, sexual health practices, access to care, social determinants of health, public health interventions. The community health team is here to support and educate you, of course. Hello, everybody. My name is Corey Haskell, and I use he, him, his pronouns. Today, I'll be discussing International Day Against Homophobia, Trans, and Biphobia. I'm a social media influencer with the Whitman-Walker Health Team and Community Engagement Team, here to support you. So a little bit of back history on the topic for today. The statement, all humans are being born free and equal in dignity and rights, appear in Article 1 of the Universal Declaration of Human Rights. And though the United Nations General Assembly proclaimed the document as a common standard of achievement for all people in all nations. In 1948, it wasn't until 1990 that homosexuality was declassified as a mental disorder by the World Health Organization. It was on the 17th of May, hence the day of observation. Still more than one-third of all countries criminalize same-sex relationships. LGBTQ plus people face prejudice, discrimination, stigma, hostility, and violence. They are denied legal protections, essential health care, civil and human rights, including a right to a bodily anatomy when forced to go through medical treatment and needless surgeries. This year and this year's theme is Our Bodies, Our Lives, Our Rights. UNFPA stands for the work towards rights and choices for all. Everyone has the fundamental right to make decisions governing their bodies, lives, and futures. Yet too many marginalized people cannot take the right for granted. They cannot fulfill their full potential without exercising bodily anatomy, for it's the right upon which other human rights are built. Today, the International Day Against Homophobia, Biphobia, and Transphobia, founded in 2004. This aims to raise awareness for violence, discrimination against the LGBTQ plus people, to drive positive change, and now is celebrated in more than 130 countries around the world. Ooh, what happened to Whitman-Walker? So, an acronym for IDHOPIT reminds us that there is still a long way to go for all LGBTQ plus people for free and safe from harm. Here are some reasons why we still need it in 2022, and ways that we can all help as a community or an ally. So in Poland, anti-LGBTQ plus rhetoric has been widespread in recent years, stoked by President Andrzej Duda, who recently stated that LGBTQ plus people are an ideology, even more destructive than communism, and pledged to ban the propaganda of this ideology in public institutions. More than 80 local governments in Poland have declared themselves LGBT-free zones. More than 80 local governments in Poland have declared themselves LGBT free zones, pledging intolerance for LGBTQ plus people, and banning LGBTQ plus events. This government campaign fuels hatred and fear for LGBTQ plus people amongst Poland's wider population. In 2019, a survey, when asked why they thought was the biggest threatening facing them, the most popular response amongst Polish men were under 40 was the LGBTQ plus movement and gender ideology. So that's like a huge that's a huge number. Like majority of men, the most popular response in Poland amongst Polish men under 40 was the LGBTQ plus community. That's the biggest threat facing them. That's huge. How to help? You can donate to support the work of Polish charity KPH. It's a campaign against homophobia, which works nationwide to advocate for LGBTQ plus people. It distributes funding to smaller grassroots organizations as well. So that's a way that you can help. For the LGBTQ plus community in Poland is by donating to KPH. Let me back this up because you can't see my face. Donating to KPH. The next place in Brazil's President Jair Bolsonaro has attacked what he calls gender ideology. Has stated that he would rather his son die than to be gay. Has advocated physical abuse of LGBT children. So this is the president of Brazil. This man literally has stated that he would rather his son be dead than to be gay. as well as he advocates physical abuse to LGBT children. And this is still going on to this day. That's scary. Brazil has been ranked the deadliest country for trans people. Brazil has been ranked the deadliest country for trans people, with 175 trans women murdered in 2020 alone. India Sakura, a trans woman activist and politician in Rio de Janeiro, told Stonewall that trans people in Brazil live in a context of total abandonment by a society that attacks and kills us. Wow. During the president's reign in 2018 election campaign, 2 trans women were killed in attacks were attackers from the president's, and these were attackers used like the president's name. So these were people that said that they did this in the name of the president. So basically, he's fueling hate. With more elections next year, campaigners are concerned that this violence will intensify further. Wow. How to help? Casnim, Grupo Akeras, Pela Vida, and are some grassroots organizations working on the ground with trans people in Brazil, and are currently accepting donations. Number 3, Hungary. Hungary far right ruling party, Fidesz, has signaled its intention to change constitution to defend so-called Christian values. They recently banned the legal recognition of trans people and LGBT people from being parents. So in Hungary, if you're LGBT, you can't be a parent. That's crazy. There are numerous Hungarian organizations working to support LGBTQ plus people, such as the Hungarian LGBT Alliance, Hatter Society, and Trans Vanilla Transgender Association, all of which welcome donations and support. The UK. It is easy to see homophobia, biphobia, and transphobia as something that happens elsewhere, but IDAHOBIT prompts us to look closer to home too. Transphobia is prevalent in the UK. That in 2017, a trans woman was granted residency in New Zealand because of a persecution she suffered in the UK. Transphobic hate crimes have quadrupled in the last 5 years. Transphobic hate crimes have quadrupled in the last 5 years, with 4 or 5 trans people experiencing transphobic hate crimes, 1 in 4 experiencing physical assault or the threat of physical assault. Some UK media outlets frequently carry articles by anti-trans hate groups that are active in the seeking and to undermine trans people's rights. The number of homophobic attacks are also increasing, with data suggesting that it has risen more than 22% in London in the space of more of like a year span. How to help? Stonewall recently developed a list of LGBTQ plus organizations in the UK, including smaller grassroots organizations and multi-aid networks. Why not consider donating to one of them to help out? You can also find this list of organizations on the Stonewall blog page. But before we go, of course, we have to give you a few reminders about COVID-19 and the vaccines. If you've already gotten vaccinated, congratulations. You've taken a really important step to preventing yourself, your loved ones, and communities from illness. The Delta variant is soaring across the United States at the moment, and it's totally understandable why you want to keep wearing your mask. The vaccine is not 100% effective, and more contagious variants are spreading, and there are many few protocols to say, to know if someone's actually been vaccinated or not. Keep staying alert. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health COVID-19 vaccine is available for everyone 12 and up. Please reach out to us at 202-207-2480 to make an appointment. If you're having trouble making an appointment with us for DC residents, you can find information on COVID-19 vaccine walk-up locations and eligibility at vaccinate.dc.gov or by calling 1-855-363-0333. Track the speed of COVID-19 vaccinations lines by visiting coronavirus.dc/don't wait. For Maryland residents, you can learn more about the vaccine distribution process and schedule a vaccination appointment at covidlink.maryland.gov or by calling 855-634-6829. If you live in Prince George's County, visit their vaccination registration portal here. If you live in Montgomery County, visit their vaccination portal here as well, or call 240-777-0311 to schedule an appointment. For Virginia residents, learn more about the Virginia vaccine distribution process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 877-829-4682. If you haven't been vaccinated and you're not looking to schedule an appointment, please continue to follow CDC's guidelines for mask wearing, quarantining, social distancing, and the like. It is very important that you consider getting vaccinated and discuss precautionary measures with people around you. Be mindful of masks and keeping your distance, especially when you are not sure if the person has been vaccinated or not. Remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker and checking our website at whitman-walker.org for the most up-to-date information on our services and more COVID-19 resources and general Whitman-Walker services. Please call us at 202-797-4439. Follow some more of our programs at WWH Family, at Real Talk DC _ and at No Filter DC.